keep working. Your work is more important than these.
Okay, Bob, I see you've got that demated. That's going to go to the adjacent lithium-ion battery. Just make sure the gap spanner stays clear of it inboard, and get a good inspection on it, and let me know if you want the instructions for the twist in the cable. And Bob, I should mention you need to remove that connector cap first, so you can red to and remove that.
Okay. Yeah, I'm clear of that feather off of that scoop, but I can use it for keep with it. No big deal. All right, Jasmine, H2 on battery 6 is installed straight up.
Copy.
Looks like 3 o'clock.
Good install. And for H1, you'll be going to, that should be down and slightly to the left.
All right, a little bit. I was using that scoop for a minute. J4 looks clear, and B4 looks clear. EMI band looks good. Can you say the words about the twist in the cable?
With the pins toward structure, you would want to rotate no more than 1 turn clockwise.
Now approaching 5 hours walk, running ahead of their timeline today, Cassidy and Bankin were able to tackle the first task planned for next Wednesday's second spacewalk to replace batteries for the S6 Truss's 1B channel. Having completed all of the planned first spacewalk involving the removal of 3 aging nickel-hydrogen batteries from the truss assembly and installing 2 in the truss. The spacewalkers had time to remove a 4th nickel-hydrogen battery, planned a spacewalk, and moved an adapter plate into the truss to await the installation of another lithium-ion battery next Wednesday. Now they're moving on to the second task, originally scheduled for next Wednesday.
I think that where the point goes, I just use the battery that we attached it to push it along the side so it sticks up a little bit, but it won't interfere with the battery 6 to go on that adapter plate. J4 is
involve removing the 5th of 6 nickel hydrogen batteries plate.
Connector cap you removed can go on the adapter plate where you removed the cable.
the cap is reinstalled.
Copy that, Bob. And Chris, did you get that second scoop on H1 already?
I picked it up on right now.
Copy that, Chris.
Going in, Joseph. And there you go. Each one, 10 o'clock.
Affirm. And Bob, we'll have you just hold still for a little bit, just looking at your met rates.
Okay. Jasmine, I can break work on H1 if you'd like me to.
Chris, hold one.
Okay. And then our cheat sheet out, it looks like one car comes over, one more. Yeah, one more spot. One more spot.
Okay.
And then we. Yeah.
Chris and Bob, I'm back with you after a little handover. We'll take a glove, hap, and gauntlet check from both of you.
Well, good afternoon, and to our fellow Americans out west, good morning. Today's meeting of the White House Coronavirus Force, and I'm pleased to be joined by many members of the task force with us. I want to thank Secretary Azar, I want to thank Secretary Azar, Dr. Burks, Dr. Fauci, Dr. Redfield at the CDC, as well as our Attorney General, Dr. of the U.S. Public Health Service. We'll make a series of presentations to update the American people on the coronavirus pandemic in the country, and then be available to take questions. But we very much appreciate the attendance of all who are here and all of you who have made time to tune in. As we reported today, we have now more than 2,500,000 Americans that have contracted the coronavirus. And sadly, we've lost more than 126,000 of our countrymen to this disease. For the President and for every American, when we express our sympathies and our deepest condolences to all the families who have lost loved ones. Despite those losses, since the end of our 45 days to slow the spread and the beginning of efforts to open up America, thanks to the cooperation of the American people, of governors and state health officials, proudly say of the entire federal team under the leadership of Trump, we have made truly remarkable progress in moving our nation forward. We've all seen encouraging news as we open up America again. More than 3 million jobs created in the last job report. Retail sales are rolling. And of course, the extraordinary progress in New York, New Jersey, Connecticut, and New Orleans, areas that just a matter of a month ago were struggling under the weight of this pandemic, and now have arrived at a very... As we stand here today, all 50 states and territories across this country are up safely and responsibly. But with cases rising, particularly over the past week throughout the South, President Trump directed our task force to brief the American people on several topics. First, we want to share with you, as Dr. Burks, what we're seeing in the rise of new cases, that 40,000 new cases in a single day. Secondly, we want to speak about what we've done and what we are doing at the federal level to support state efforts, particularly in the states where we see rising cases. We'll talk today about how this moment in the coronavirus pandemic is different than what we saw 2 months ago, to better people to respond. And ultimately, we will speak about what every American can do to play their part in the spread and the impacts of the coronavirus pandemic. Also, I've spoken to governors in Arizona and Florida and Texas in the last 12 hours. And Dr. Burks and I will be traveling on Sunday to Texas, on Tuesday to Arizona, and I'll be traveling to Florida on Thursday of next week to get a ground report. And of course, on Monday, we will conduct what will be our 26th weekly call with the entire White House Coronavirus Task Force and all of the nation's governors as we meet this moment. Now, as I mentioned, it's important gathering, I think, that we take a step back and think about how far we've come. When the President tapped me to lead the White House Coronavirus Task Force, he said we had one mission, and that was to save lives. President Trump's decision to suspend all travel from China in January, to stand up the White House Coronavirus Task Force, in February to declare a national emergency, to travel from other places around the country, all contributed to time to stand up a broad-based response, the whole of government response that we spoke about so many times at the podium throughout this. The State Department also coordinated the repatriation of Americans. And then came the moment when we brought this chart to the President of the United States on the counsel of our very best scientists. The President was presented with a decision. We did nothing, no intervention. The possibility existed at that we could lose between 1.5 million and 2.2 million Americans. But with mitigation, by calling on the American people to embrace the social distancing that were called upon to slow the spread, that would become 45 days to slow the spread. Our believe that we could reduce the number of American fatalities, number ranging between 100,000 and 240,000. The President made that decision, and we unveiled the 15 days that became the 45 days to slow the spread. And inarguably, as we see where we are, because of what the American people have done, because of the incredible work of our healthcare workers, because of a partnership with governors in every state, we did just that. We slowed the spread. We flattened the curve. We saved lives. That we exponentially scaled testing capacity, partnering with private sector, commercial laboratories. We've now reached some 30 million tests across the country, conducting some 500 a day. In that partnership with governors also, the President directed us to make sure that states had what they needed when they needed it. And at this point, pleased to report that the federal government both delivered and facilitated of billions of supplies of face shields and gowns, gloves and masks, and we continue to be on track to construct more than 100,000 ventilators in 100 days. And as I spoke to governors last night, they confirmed to me again what FEMA's reported. We have no outstanding requests from any state at this time for personal protective equipment or medical supplies. Let me say that again. In the affected areas, particularly the states down south that are seeing rising cases, we have no outstanding requests. But as I told the governors, we are ready at a moment's notice to surge personnel, to surge supply, to expand capacity, and to support their healthcare response. In the midst of all of that, I think it always bears saying that because of the great work of our healthcare workers and because of American manufacturing, no American who required a ventilator has a ventilator in the United States. I consider of a national accomplishment. We also surged hospital capacity in areas of the greatest anticipated need. We sent military and National Guard personnel. These charts showing the progress that we've made in New York and New Jersey and New Orleans all demonstrate the efforts of the people of those states in cooperation with the great healthcare workers to show the progress that we made in areas that were once deeply impacted. And we extend our thanks. We extend our thanks to the people of each of those for the sacrifices that they made in challenging times. But at the close of that 45 days to slow the spread, we plan to safely reopen America again. And territories are moving forward. And as I said, we're seeing America go back to work. And in much of the country, we're seeing jobs, economic activity expanding. But our focus today is very much on the advent of a rising series of new cases across the American South. But where our first mission was to save lives, once we came out of the 45 days to slow the spread, what our task force has been focused on over the course of the past 2 months is to save lives. And in fact, we've had some 17 meetings of the White House Coronavirus Task Force in the intervening days since we began the process of opening up America again, and we've been working very closely with states to move that agenda. But as the President has made clear, we want to open our economy up, and we want to move America forward, even while we take and continue to take the steps necessary to help the American people. We stand here with the rising cases among southern states. President Trump asked us to brief the American people to give details on what we're seeing, what we're doing, and how it's different from 2 months ago. As you may recall, after seeing overall cases drop from 1,000 a day average in April to 25,000 a day of average in May. The first few weeks actually saw cases averaging roughly 20,000 a day. We now have seen cases begin to rise precipitously across. In fact, 34 states, let me make sure I've got my numbers exactly right here. As we reported early on, 34 states across the country, though, are experiencing a measure of stability that is a credit to all of the people of those states. And when we speak about stability, we're talking about not necessarily states where there are no new cases, states where there are either no new cases and no rising percentage, or no combination of those two things. There may be states that are seeing a modest increase in cases, but their percentage of positive rates has remained very stable. And but nevertheless, there are 16 states with rising cases and rising percentages. We'll be focusing on those states today. The first thing we'd share with the American people is that while there is a penchant in the national debate to use and to paint an entire state one color, cases in a portion of the state, this is actually a better picture of the data that we literally analyze every single day. Dr. Birx will take a few moments to the specific outbreaks in Texas, Florida, Arizona, and California. But the first thing we would convey to the American people is that from this new positive results in the last 3 days, you can see the concentration of new cases in specific parts of states, and of course, very specifically in parts of the country. Secondly, we want the American people to understand it's almost inarguable that more testing is generous. To one extent or another, the volume of new cases coming in is a reflection of a great success in expanding testing across the country. As I said at the top, we're testing more than ever before, some 500,000 people, and perhaps we could go to that testing chart if it's there, just to show you the acceleration testing that's taken place over the course of this pandemic in the United States. It's truly been remarkable, and it's been a public and private partnership from the very outset. That we're seeing among the cases, and we hear this in Florida, and we hear this in Texas and elsewhere, is that roughly half of the new cases are Americans under the age of 35, which is at a certain level very encouraging news, tell us, because as we know so far in this pandemic, that younger Americans are less susceptible to serious outcomes of the coronavirus, and that we are finding more younger Americans who've contracted the coronavirus, good thing. And so we'll speak about the testing, and Admiral Brett Giroir is here and can detail any questions that you might have about testing going forward. Thirdly, we'll talk about what these new numbers mean and how we can address them. And Dr. Fauci will speak about that in just a moment, particularly in the affected areas. And the other area that we spend a great deal of time thinking about is hospitalization. Not only do we track new cases every day on a county-by-county basis, but we also, and the map on the left of your screen represents how and healthcare workers have the resources and support they need. Again, as in the matter of new cases, it's highly focused, highly detailed, and highly specific. Secretary Azar will speak about hospitalization, the work of HHS to make sure that our hospitals around the country have the capacity to. But as Dr. Birx may well reflect as well, we are encouraged that where 2 months ago we were seeing some 15% of new cases being hospitalized, now that number is averaging roughly 5% around the country, which is also encouraging news to say the least. And so the while we have 16 states that we're focusing on, again, I would just reiterate to the American people, the useful thing to know is where it's happening so that you can take the steps necessary to do your part. But rest assured, in our conversations, all of the most impacted states, we continue to be assured that hospital capacity remains strong, and they know the federal government stands ready to provide them with the personal protective equipment or supplies or even expanded capacity and personnel to meet any moment. But at this point in time, we are told that in all of the states most deeply impacted, hospitalization remains very, very broadly available. Finally, I'll speak about the progress that we've made as a country on the most difficult aspect of this. I said at the beginning that our hearts and our prayers to the families who've lost loved ones in the course of the coronavirus pandemic. And I know I speak on behalf of everyone in this country when I extend our more than 126,000 families that have lost loved ones. As the President has said many times, one life lost is too many. But nevertheless, we, at this point in the course of the pandemic, we can still take some comfort in the fact that fatalities are declining all across the country. There literally was a day 2 months ago this week where we lost 2,500 Americans in a single day. This week, because of the extraordinary work of our healthcare workers, because of the availability of new remdesivir, new treatments like steroids, and because of the cooperation of the American people, heeding the guidance that we gave at the federal level and state and local officials gave. This week, there were 2 days where we lost less than 300 Americans. And you can see from this chart what has been a precipitous decline from some of the worst moments of this pandemic as it impacted areas of New York and New Jersey and the Northeast. I have a heavy heart anytime I recite these numbers, but making progress, reducing the number of Americans that we have lost and are losing, I hope is an encouragement. Because as we see new cases rise very carefully, there may be a tendency among the American people to think that we are back to that place that we were 2 months ago, that we're in a time of great losses and great American people. The reality is we're in a much better place. With the efforts President Trump mobilized at the federal level, with the efforts of this team, the efforts of governors across the country, our incredible healthcare workers, and the cooperation of the American people. The truth is we did slow the spread. We flattened the curve. We resources and the capacities in our healthcare system to be able to meet in a way that would put the health of all of our country. We also cared for the most vulnerable and continue to focus resources on the most vulnerable, seniors with serious underlying conditions. And all my heart that we've continued to save lives. We've created a solid foundation for whatever challenges come, either in the days ahead or in the months ahead. And that's a credit. That's a credit, I believe, to our President, to our federal team, to our state partners. It's a credit to the American people and our healthcare workers. And so we stand here today, we believe we've made progress. But as we are reminded, as we see cases rising across the South, that we still have work to do. And so we say to particularly those in counties and in states that are being in cases, that now is the time for everybody to continue to do their part. And I think you'll hear from this podium today a particular message to younger Americans. Younger Americans and the role that you can play in protecting the vulnerable, and making sure that while the coronavirus doesn't represent as significant a threat for a serious outcome to American, none of us would want to bring to our parents or grandparents, moms and dads, an elderly friend or a friend who has an emergency and cause a serious outcome as well. And so we leave you just with the guidelines for all. When we put out the guidelines to open up America again, we laid out at the outset guidance for responsible reopening, and states across the country, as I mentioned, are doing just that. 34 states are opening safely and responsibly and seeing low and steady cases and not seeing a rise in the percentage of positives. And in the 16 states that are being impacted, particularly those that we'll focus on here today, we would just encourage every American to follow the guidelines for all the phases. Continue to practice good hygiene, wash your hands, avoid touching your face, disinfect frequently. People who feel sick should stay home, and when it comes to business, social distancing, protective equipment, temperature checks, testing and isolation. These are the guidelines for all of the phases, and they are good practices to if you're in a community that's affected, or even if you are not, because we're all in this together. And the progress that you saw illustrated in those charts in places New York and New Jersey, Connecticut and New Orleans was a result of the stepping forward, heeding the guidance of federal, state, and local authorities. And we encourage you to continue to do just that. But for those in the areas most affected, we to listen to and respect the guidance of your state and local authorities. Recognize that this is different than 2 months ago, both in our ability to respond and in the nature of those that are being infected, and that younger Americans have a particular responsibility to make sure that they're not carrying the coronavirus into settings where they would expose the most vulnerable. And lastly, as I prepare to bring Dr. Birx to the bridge, every American to continue to pray. Pray for all the families that have lost loved ones. Pray for our healthcare workers on the front lines. And just continue to pray that by God's grace, every single day, will each of us do our part. With that, I'll introduce the coordinator of the coronavirus, Dr. Deborah Birx.
Thank you, Mr. Vice President. Thank you for that great introduction. Everybody, where we have come from in the last 4 months. We have a great deal of understanding now about the differential disease. Differential infections, no. We believe everybody is susceptible. But we know infection leads to a spectrum of disease, and we have much better details about who is vulnerable and why they are vulnerable. And as the Vice President said, at one time, we were diagnosing people in the ICU after they came into the emergency. And thanks to the millennials who have been heeding our guidance, they have been coming forward and getting. And so whereas before we told them to stay home, now we are telling them to be tested. And this is a great change for us. It allows us now to find the asymptomatic and the mild diseases that we couldn't find before. As Dr. Redfield talked about yesterday, from the serology test, we have a great understanding of what was happening and the number of asymptomatic and mild conditions that led to individuals to have antibody, but never come forward with significant disease. We now know who's at risk of disease, and we now know it's particularly the elderly, individuals over 80, and individuals with comorbidities. And remember, those comorbidities span the entire. We do know that we have people in the younger age groups with significant type 1 diabetes, and may also have individuals with significant obesity. We know that those are risks. So risk factors go with your comorbidity, not necessarily age. And so as we call on individuals to protect one another, by the street, you don't know what comorbidities they have. And this is why we've been focused on one another. We also know who's at risk for the highest mortality, and because of that, we've been able to, the clinical care has dramatically improved. And I want to thank NIH, who has been working constantly to update the clinical guides. So physicians around the United States and frankly around the world who are using those have the most update about how to actually improve disease courses of those that are in the hospital. Have improved treatment in the hospital that we didn't have in March and April, with improved methods of oxygenation, which is really quite important, improved treatment of acute respiratory individuals on the ventilator, and we know now will respond quite well to steroids. And then research that is ongoing on what we call the acute cytokine storm. That is when often in that later stage when people are on ventilators, the seriously ill may need other items, and that's being researched. And the work that's being done on clotting research by the NIH. We also have new therapeutics that have been used both as compassionate use like convalescent plasma, and now remdesivir, that we just reallocated and ensured it was available to these states that are facing the increased hospitalization, as well as the monthly allocations that we have been sending out. If we can go these and start where the Vice President left off, this disease is tackled community by community, testing at the community level and working with community groups to understand the spread in those communities. And so we've spent the time to make new positives down to the level of communities to understand where spread is occurring. We can match our prevention interventions to those areas. Next slide, please. As we discussed, and it's difficult for you to see on this graphic because the top line is New York. And we should remember where we were and that slope, that early slope that you can see in the New York cases, that rapid acceleration. On the same slide, you can see California, that is the blue line that is just passing the orange line, and also on the slide, Florida and orange, and Arizona at the bottom. Dramatic as these slopes are, they are not equivalent to the original acceleration that we saw in New York. That doesn't mean that we aren't absolutely focused on working with the governors in those communities to stop the spread of the virus in those 4 states. Next slide, please. Through the entire country that we're tracking state by state. Now, obviously, this axis is vastly different than the one on the prior slide because that slide included all of the cases in New York City. But you can see on this slide that we've been tracking very closely North Carolina. A team's been in with North Carolina working with the state and local health authorities to really respond to the changes there, as well as the South Carolina. I'll just go quickly through these so you can see Oklahoma's at the bottom of this slide. And next slide, you can see on this slide Idaho and Oregon. Those are the ones in the light blue and the dark green where you see an inflection in their slopes. These inflection points and why they occur are critical for understanding how to prevent the spread. Next slide. Vice President talked about is we've created an alert system that brings together rising cases with an understanding of test positivity. And so this chart, which is difficult for you to, those states on that far side that have the high that you can see at the higher level of the graph. Those are the states that we have concerns about because the rising number of cases positive. This explains community spread. In states that have increasing cases but falling test positives, it tells us that they're getting into the communities to find the asymptomatic cases. And so these are the things we put together to understand the full picture. Next slide, please. So this really puts on one slide the states that we have that we've been talking about across have our greatest concerns. The 2 top increase in test positives are Texas and Arizona, followed by Florida, Mississippi, South Carolina, Alabama, Georgia, Louisiana, Nevada, and Utah. Those few states are under still 10%, but we're tracking them closely as we look at that individually. Finally, next slide. You can see on this slide, we are tracking, and this is when you hear about we have a certain 2% or 3% of the counties under specific alerts. So it doesn't matter, we're tracking the increase and the rate of increase at new cases at the county level. We currently have about 130 counties out of the 3,100 in the United States in that category. Next slide. Metro level, this shows you the case positivity by the metros. And the number of tests that have been done. Next slide. And then this shows you the change over time of test positivity in the largest metros where we have concerns, and this is Austin, Phoenix, Houston, Dallas, San Antonio, Tampa, Orlando, Miami, Riverside, California, and Atlanta at the bottom. This is how we continue to integrate data on cases, data on testing, and data on hospitalizations so that we can work with the states for a comprehensive integrated response. Next slide. I know many of you would be interested in seeing how high the test positivity rate became in March and April. So that top line is New York City Metro, and you can see it reached over 50% for almost 2 weeks. 50% of the tests were positive for COVID-19. Underneath that, you see New Jersey and Minnesota and a whole series of individuals. Detroit is the second. Next slide. So quickly to show you how we look at this at the state level and work in the local health authorities. So this is Florida. We track testing, it's done, the number of tests positive, the total number of cases seen in the black bar, and what we call the syndromic presentations of early respiratory diseases and pneumonias. Next slide. This then, we look at the county level to look for changes in the slope of the number of new cases. You can see that top county that has the largest increase in slope in cases, Miami-Dade, followed by Broward and Palm Beach. All the other counties are much lower in their daily case increases. This allows us to focus resources and testing into these specific sites. Next slide. That all comes together to create this graphic so that individuals understand and we can understand precisely what the rate of growth is and where the rate of growth by the shading of the boxes. Now I'm going to quickly take you through Texas because it's a slide. So this shows you the exact same graphics now shown for Texas, showing a continued rise in the daily test, but also a rise in the blue line. You can see throughout May, after opening, their test positivity continued to decline as their testing increased. It was in the last 2.5 weeks that we saw this inflection of rising test positivity along with rising testing. Positivity that alerted us, along with the increased cases, that this was becoming. You can see in the red boxes, everything is heat mapped. So at a glance, you can tell those 2 boxes that are in the middle that are red, showing that this has rising cases and rising test positivity. Next slide. But even in Texas, next slide, please. And this gives you a map of Texas, or shows where the cases are and where they're rapidly. And finally, I'm just going to go through Arizona very quickly along with California. So next slide. Same situation that we're showing here with Arizona, rising number of tests being performed, but also rising test positivity, rising cases. Next slide. Arizona is unique, and they have essentially that is primarily represented by the depth of the new cases, and this is in the Phoenix area. Next slide. Then next slide. So this is California. And so you can see California over the last week has had that increase in test positivity. You can see that increase at the end of that bar in the blue line, along with still increasing testing that has been done. And we just want to thank all of the governors and all of the work at all the laboratories that has allowed us, along with HHS and Brett Gerard, who ensured that the supplies were there to really orange lines. You could see in each of these cases, these orange lines have dramatically gone up over weeks. Next slide. And like New Mexico, the primary infections right now in California at the highest level are in the LA area. But because LA is a large metropolitan area, next slide, you really need this kind of more specific and local graphic to really show that it's also increasing in the Central Valley. Ability to focus resources among agricultural workers to improve testing and isolation for those who become positive. So I just wanted to take you through how we consolidate that data and then Monday reporters. We hope over the next week to be able to really have this data available on the White House website so that everybody across the country can see where the case is. Because in the end, we really want to call to action. When we started talking about what can be done, we said the most important thing that would change the spread, and I'm going to turn that over because I know Tony's going to talk about it, is really individual behavior and our respect for one another through social distancing, wearing a mask, and ensuring that we're protecting the most, maybe in multi-generational households. And thanking again the millennials who have come forward And I know during the protests we asked to get testing, and we see those testing rates really improving in the under 40 age group. That is going to be important to continue to accelerate testing among the under 40 age group, because that's the age group most likely to have asymptomatic spread and be spreading the virus unbeknownst to them. Make it clear, no one is intentionally spreading the virus. They don't know that they're positive, they don't have symptoms, and need to be tested in order to have that awareness. And so we really want to thank them again for coming forward and really enriching the amount of testing that has been done in the under 40-year-old age group. And to our older population, you know, if you have comorbidity, you're over 80, we ask you, if in these hot spots in these states that are having expansion in cases, to continue to shelter as much as you can and use your to go and do your shopping.
Dr. Birx, and thank you, Mr. Vice President. So I want to extend just for a couple of minutes some of the both by the Vice President and by Dr. Birx, and it has to do with the situation that we find ourselves facing right now. It's very clear from the maps that you saw, areas in the country, states, towns, cities, regions, that are doing very well, that have followed the guidelines and are opening up, that's been effective. However, as you can see, we are facing a serious problem in certain areas. Now, when you look at the map, it's very interesting because you see some dark parts of the map and some light parts of the map. We have a very heterogeneous country, but heterogeneity is intimately interconnected with each other. So what goes on in one area of the country ultimately could have an effect on the other areas of the country. So let's take a look at this problem that we're facing now, this resurgence of cases. I don't think there's time to try and analyze and figure out the multifaceted elements that went into that. You know, everything from maybe opening a little bit too early on some, to opening at the right time, following the steps in an orderly fashion, to actually the steps in an orderly fashion. But the citizenry did not feel that they wanted to do that for a number of reasons, likely because everyone feels the common feeling of being pent up for such a long period of time. So we're not going to say blame, we're not going to try and analyze it, but there is something that's very important about it that I'd like to give a message to the country in general. When you have an outbreak of an infectious disease, it's a dynamic process that is global. So remember, what happened in China affected us, in Europe affected us, what's happening here is affecting others. We can't get away from that. It's interconnected. So therefore, if we are an interconnected society, we've got to look at the fact of what our role is in trying, because everybody wants to end it, everybody wants to get back to normal, and everybody wants the economy to recover. I think we all are pretty common in that. That's a given. What can we do? What I think, upon talking to a lot of people and reflecting on it, we have such an unusual situation because of all of the decades that I've been involved in chasing infectious diseases. I've never seen anything that is so protean in its ability to make sick people. There's no other infectious disease that goes from 40% of the people having no symptoms to some having mild symptoms, to some having severe, some requiring staying at home for weeks, some going to the hospital, getting intensive care, some getting intubated, some getting ventilated, and some dying. So that depending on where you are in that spectrum, you have a different attitude to this particular thing. But anyone who gets infected and get infected, to a greater or less degree, is part of the dynamic process of the outbreak. And I know, because I can understand when I was at a stage in my life when I said, well, I'm involved, I'm going to take a risk. I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you. Because if you get infected, you are part, inadvertently, of propagating the dynamic process of a pandemic. Because the chances are that if you get infected, that you're going to infect someone else. And although you may feel well, and because we know, if you look at here later on, the overwhelming majority of infected are young people, likely the people that you see in the clips and in crowds enjoying themselves, understandably. No blame there, understandably. But the thing that you really need to realize, that when you do that, process. So if you get infected, you will infect someone else who clearly will infect someone. Happens because the reproduction element of the virus is not less than one, infecting other people. And then ultimately you will infect someone who's vulnerable. Now that may be somebody's grandmother who's on chemotherapy, aunt who's on radiation or chemotherapy, or a child who has leukemia. So there is what I call, and again, without making it seem that anybody's at fault, you have an individual responsibility to yourself, but you have a societal responsibility. Because if we want to end this outbreak, really end it, and then hopefully when a vaccine comes and puts the nail in the coffin, we've got to, that we are part of the process. So when the Vice President went back, pulling back a couple of months ago, when we showed about guidelines to safely reopen the country, we've got to make sure we drop back a few yards and think about that this is part of a process. We can be either part of the solution or part of the problem. So I just want to make a plea with people when they are there, as we try to tackle not only those states, but the light-colored part of the country, even though they've done well. They may have gotten hit badly like New York and then came down, or they may not be at all. They are vulnerable. If we don't extinguish the outbreak, sooner or later, even ones that are doing well are going to be vulnerable to this. We need to take that into account because we are all in it together, and the only way we're going to end it is by ending it together. Thank you.
Well, first, thank you all for joining us here at HHS to update the American people. I want to begin by thanking everyone around the country working to defeat this virus. All of the healthcare providers, those working to reopen our economy safely, the American people who have sacrificed so much in this fight, and the incredible members of our HHS team who've been working tirelessly to protect the health and well-being of all Americans. Before covering today's topic, I want to mention a major milestone for global health yesterday. The end of the second largest Ebola outbreak in history in the Eastern Democratic Republic of the Congo. We congratulate the Congolese government and all of the healthcare workers and community members involved, some of whom I had the chance to meet and thank in the DRC last fall. Under President Trump, the United States was proud to play a bigger role in this major public health victory than any other single nation. And now, thanks to the President and the hard work of our team, America has never been readier to combat COVID. We've built up our readiness under the strategy we developed to address surges, save lives, and in time defeat the virus. We're in a much stronger position individuals as they fight back. There are 6 parts to the strategy: surveillance, testing, containment, healthcare capacity, therapeutics, and vaccines. First, surveillance, so that we can be aware of and respond to surges. Being able to track more cases among younger Americans that we never would have caught earlier in the pandemic. Second, we have the world's greatest testing capabilities, enabling us to confirm the presence of the virus when it crops up, confident that capacity will continue to rise. Third, states are building the capacity to track and contain outbreaks of the virus. With federal help, many states have substantially expanded their own capabilities and were deploying knowledgeable, experienced CDC and HHS public health teams to the areas now seeing increases, with a focus on community testing and community-based interventions. Fourth, we're helping healthcare systems secure sufficient capacity. We've dramatically expanded American manufacturing of PPE, and the FDA has authorized to sterilize equipment for reuse. We've spoken with hospitals and their own PPE reserves, many of them getting up to days of supplies. Through the Strategic National Stockpile, we have far more visibility across the country, including centralized coordination capabilities that we lacked just a few years ago. Visiting healthcare providers around the country, I've seen how they're adapting back while taking appropriate precautions. America's hospitals are ready to get back, maintaining their readiness for COVID-19. The 5th and 6th is Operation Warp Speed. We now have promising therapeutics that are benefiting tens of thousands of American patients and in all likelihood have already saved thousands of lives. We've identified two very promising pharmaceutical treatments, remdesivir, dexamethasone. As of today, we've allocated more than 120,000 courses of remdesivir to all of the 50 states. We've added dexamethasone, a very low-cost steroid, to our treatment guidelines, and we believe it's reasonable to assume that other corticosteroids more readily accessible in some places with immunological effects. Another promising therapeutic, convalescent plasma, has been used to treat more than 25,000 Americans in nearly 3,000 sites across the country. There are no certainties in science, but with 40 clinical trials underway in the U.S., it's more good news on therapeutics is on the way and on the way soon. Finally, we've announced large investments to support 3 different vaccine candidates all the way through to manufacturing. These candidates are now in human clinical trials, potential to start delivering safe and effective doses before the end of the year, and we'll be adding support for several more candidates. We're expanding manufacturing capacity and already making the vials, needles, and syringes that we may need. Our capabilities have grown exponentially in the time of sacrifices of the American people. We have a much better grasp of the virus as much more data with which to model it. With that data, as you've heard today, we can focus. We have some very concerning hotspots, and we can track when other hotspots emerge, as we expect they may. We're focused on the states and the counties within those states, just 3% that represent hotspots. It's important for the American people to be aware of this variation across the country. Americans need to understand their local trends because we want to help people make the right decisions for themselves. Making decisions for yourself has to be based on 3 axes of risk, as our Surgeon General taught. Assess where you are, who you are, and whom you activity you're thinking about doing. There are gradations of risk within each of these axes. Going to an outdoor restaurant in Montana is a great deal different from a crowded indoor bar in Houston. When you interact with fewer people, when you interact with them for a shorter period of time, your risk is reduced. Individuals can balance these kinds of factors. What I've laid out today is remarkable progress by the President's administration and a particular credit to HHS. We've got a lot of work ahead of us, but Americans can be confident that we have a rocket to help us get safely back to work, back to school, back to worship, and back to health care while we tackle surges of the virus where they occur. Thanks to President Trump's leadership, we've got the capabilities, the knowledge, and the strategy to protect Americans' lives and their livelihoods at the same time. And every American should feel proud of that. Thank you.
Great. Great.
Thank you, Mr. Vice President. I wanted to add some comments. Once again, I want to stress and thank all Americans to embrace the importance of social distancing recommendations to slow this. As I've said before, we're not defenseless. These are, in fact, very powerful weapons and a responsibility to recommit ourselves to put them into routine practice. Again, to stay 6 feet apart from each other as much as possible, to wear face coverings when we're in public, and to practice vigorous hand hygiene. To do so, as we've heard today, to do our part to protect the vulnerable. I also want to appeal to the millennials and those that are under 40. It's really important that this group themselves to these practices. And it's not just the elderly that are at risk. Many of us may have friends and colleagues that are younger that may not advertise their underlying comorbidities, as the case would be with, say, type 1 diabetes or an underlying immune deficiency. Again, asking this team and younger people in this country to come and commit themselves. I agree with Ambassador Birx. We're very thankful. The group is now coming forward to get tested, but I want this group to put into vigilant practice the importance of our social distancing. What I wanted to stress, though, is that there are differences in what we're experiencing, we all experienced in March and April. And one of the things I want us to focus on is not the cases per se, consequences, the impact of those cases. It wasn't long ago, within 2 months ago, it's hard to believe, I don't think many people realize that 27% of all deaths that occurred in the United States died of a pneumonia. That was a pneumonia, could have been influenza, could have been COVID. 27%, 1 in 4 of all the deaths in the United States just 2 months ago was caused. I'm happy to say today the deaths to pneumonia in this nation is back to base percent. It's a big difference. A lot of those pneumonias that were dying were actually the elderly, individuals with comorbidities. We are seeing, despite these increased cases, a progressive decline in deaths. The last, say, 2-week average deaths now is around 650, and as you heard the Vice President, it wasn't long ago that sadly we were losing 25,000 individuals a day. So I think it's critical that we continue to focus on that, the consequences. And it's part of that why it's important that we continue forward to how we deal with and contain and control the COVID infection, but as change the consequences of the impact it's had on education in this country or as an economy and business. So again, as I close, I want to just re-emphasize how important for now, for individuals to really think seriously, as Tony said, about the responsibility to others that we have, because this infection pathogen really does have the capacity to cause quite serious illness in individuals at high. Embrace our nation's recommendations that the Vice President put up again that we have for all phases of reopening in America. I also want to thank the younger groups for stepping forward and getting tested. Clearly what we're age group is much more likely to be asymptomatic, and again, to make that commitment to do their part to protect those of us that, whether we're morbidity and would be more vulnerable to serious illness from this virus. Thank you very much.
Thank you, Dr. Redfield. Questions?
Mr. Vice President.
Yes, please.
All of the experts here within the task force are stressing the importance of social distancing and also the threat of crowds, yet your campaign has held 2 massive rallies, no social distancing, no masks. Can you tell me, even Dr. Fauci has talked about not gathering in large crowds. Can you tell me why you continue to do this, why the campaign continues?
Well, the freedom of speech, the right to peaceably assemble is enshrined in the Constitution of the United States. And we have an election coming up this fall. And President Trump and I believe that steps, as we created screening at recent events and it gives counsel that we have. We still want to give people the freedom to participate in the political process, and we respect that. I was pleased to see that now, since we were in Oklahoma, I think their positivity rate is actually declined as of today, and that's a great testament to the fact that people are being responsible. They know and understand what's happening in the community. And our emphasis today is really to say that we think it's helpful if the American people understand that what we're seeing across the South today is really outbreaks. And there are outbreaks that are in specific counties. In some cases, there are outbreaks that are in specific communities. We've personnel, HHS personnel. I didn't mention before, but we're seeing similar activity in North Carolina and Alabama. We sent personnel into those states, and we've actually seen declining numbers beginning in both of those states. So the important thing is that not one size fits all. The overall guidance to every American to practice good hygiene, to practice the measures that we recommended at home and at work. But our focus today is to make sure that in those areas of the country where we're seeing a significant, not only increase in cases, but an increase in positivity level, that the American people know just what it is to listen to what their state and local health officials are directing them. Please.
I was curious, it seems like the wearing of masks has kind of become, or I guess the decision not to wear a mask. Are you concerned about that? Is there a message that you would like to send to people about the importance of wearing masks?
Well, we think that the first principle is that people ought to listen to their state and local authorities. I mean, I couldn't be more grateful for the partnership we forged with governors around the country I spoke to the governor of Florida, of Arizona, of Texas, just within the last 12 hours. And I told them that from this podium today, we would remind their citizens to heed the guidance and the direction of state and local officials. In some cases, there's statewide coverings and with regard to events and gatherings. In other cases, there are specific countywide directives, and we just believe that what's most important, listen to the leadership in their state and the leadership in their local community and adhere to that guidance, whether that have to do with facial coverings, whether it have to do with the size of gatherings, and we'll continue to reinforce that message.
Two questions, actually. You just mentioned the importance of listening to state and local authorities. What is the correlation between the spike in cases that we're seeing in states like Texas and Florida and the way those states handled their reopening? Was it too much too soon? And secondly, Dr. Fauci, you said in an interview that, quote, something is not working. What isn't working? And did you all in your meeting today come up with a plan to fix whatever isn't working?
Well, let me respond first, and then I'll let Dr. Birx may as well. I think there is for people to look at these Sun Belt states that have been reopening and putting people back to work. Opening has to do with what we're seeing in the last week or so. But in the case of each of these states, they reopened, in some cases, almost 2 months ago. And their test cases, their new cases that from testing was low and steady. Their positivity rate was low. What we're observing today, and I've heard this from Florida, I've heard this from Texas, and some other states along the Sun Belt, that we're seeing more and more young people under the age of 35 who are testing positive. In many cases, they have no symptoms. Forward and confirming that they have contracted. We're working with the states, and you speak about our plan. We've got embedded in every state in the union. We're surging more CDC personnel as of these states to help them unpack what the data is suggesting. I know the governor of Texas announced some new measures this morning, which we fully support. But what we're going to continue to do is give our state leadership the very best information, the very best counsel that we have. And if there's one message that comes through today, I hope it is saying Americans in these states and in these counties in particular that they are a big part of the numbers that we are seeing in new cases. And while the significant threat of a serious health I know of no young person, and I got 3 20-somethings in my immediate family. No young person would ever want to inadvertently expose a mom, a dad, a grandmother, a grandfather, or someone who's vulnerable to a serious result. And so alerting them that they're spread among that age group, urging them to take countermeasures and heed what their government and local officials are directing will be our continued strategy. Dr. Fauci, did you want to respond?
Sure. So what I meant by what is not working, and this is not anybody's fault or any institution's fault, is that what we're dealing with right is community spread in the context of a substantial proportion of the people who are getting infected do not know they're infected, they're not symptomatic, they're asymptomatic individuals. The classic paradigm of identification, isolation, and contact tracing to actually contain that is very at work under those circumstances. You superimpose that, the fact that even with identification, isolation, and contact tracing, often the dots, if you get on the phone and talk to people who are in some of these communities, you find that a lot of it is done by phone. And when it's done by phone, maybe half of the people don't even want to talk to one representative. If you live in a community that is mostly brown or black, you're in a different situation that maybe 70% of them don't really want to talk to you. You can identify a contact, but you don't isolate them because you don't have the facility to isolate them. That is what's not working. So what we're going to do, and we are doing, and you're going to be hearing about this, flooding the area to get a feel for what's out there, particularly among the asymptomatics. So in other words, it's a paradigm shift because we're dealing with young people, people who are going to be asymptomatic, people who are getting infected in a community setting, not an outbreak setting where you know who to identify, isolate, and contact trace. Right. That's what I meant.
So Dr.
Did you want to add to that?
Dr. Fauci and Dr. Burks.
Can I just want to finish it for just a second. About 3 months ago, we talked about how important it will be at the center. And I think when you talk about what's going to be different, and part of the reason why the Vice President have asked me to go out to Texas, New Mexico, and Arizona, is to not only meet with the state and local health officials, but to meet with the community groups so that the community groups can help us support community-specific messaging. Public health messaging, when you just keep saying the same thing over and over, people get tone deaf to it. It's because it's not tailored to their specific circumstances and they don't see that message resonating in their lives. We've had to do this across the world. I've done this over and over again for HIV, TB, and malaria. At the center of this has to be the community, and the community will help us identify who needs to be tested, identify which households have the most vulnerability in them, and how we can really go into those communities and support that response at a very local and ground level. When we started this, we were very much facility-based, and we know facilities carry us a long way. But if we want to change the transmission in these metros, in specific communities and in specific parts of those metros, we've got side by side with our community leaders and our community groups that know how to transfer our scientific dogma and information down to a level where people will understand it, hear it, and act on it. I know when they hear it and understand it, they will act on it. When you ask what's going to be different, that has already started, and it's already going to be different.
Dr. Burks.
Let me add to that. That's exactly what we did with HIV 30 years ago. We got the community involved in helping us to, and I think that's very important to underscore what's being planned to do, to get people who know the community, who live in the community, who the community trusts.
Right, right, let's go. How about right here?
Do you expect the death rate to go up in the next 3 or 4 weeks, just like we're seeing the rate of infection go up now?
Well, our hope and our prayers, we've seen, as you noted, we've seen a decline in fatalities. And again, we grieve the loss of every American life. But months ago, we had lost 2,500 Americans in a single day. In 2 days this week, less than 300 Americans. It is a testament to our healthcare workers, to all of the medicines that Secretary Azar just described being available in all 50 states. It's a testament to the efforts of the American people. We hope as we continue to engage that we'll continue to see those numbers decline. The other reason we're encouraged is because at this point, when we look at our losses, roughly 2.5% of all of our losses took place in people under the age of 25. I mean, younger Americans, and in each case, 80% of the cases, they were people with pre-existing conditions, contributed to the sad outcome. So in Florida and in Texas, they've reported to us that half or even more than half of the new cases that are showing up every day are people under the age of 35 or younger, in most cases asymptomatic. Our hope is that those younger, healthy Americans, like most of you, to go through the coronavirus, will recover. But our message today, as we've spent so much energy in the last 4 months protecting the most vulnerable, I mean, we've deployed testing resources, we've supported states' efforts. States across the country in the last month have all to test all the residents of their nursing homes, to test all of the staff on a regular basis. We need to protect the most vulnerable, and we want a message going out to younger Americans, particularly those along the Sun Belt, where we see new cases on the rise, positivity on the rise, to know that we need them to do their part to make sure and protect the most vulnerable, so that we don't see those losses rise. But it's American people, and particularly young people in this country.
All right, guys, last question.
right there.
President, thank you. A question for you, and then a question for the doctors on childcare.
Sure.
It does sound, though, like you're saying, do as we say, not as we do. You're telling people to listen to local officials, but in Tulsa, you defied local health officials to have an event that, even though you say it didn't result in a spike, dozens of Secret Service agents, dozens of campaign staffers are now quarantined after positive tests. And then in Arizona, one of the hardest hit states, you packed a church with young people who... So how can you say that the campaign is not part of Dr. Fauci laid out?
Well, I want to remind you again that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States. And American people don't forfeit our constitutional rights. And working with state officials, as we did in Oklahoma and as we did in Arizona, we're creating settings where people can choose to participate in the political process, and we'll continue to do that. I think it's really important that we recognize how important and personal responsibility are to this entire equation, but allowing younger Americans to understand in the counties that are most impacted that we're facing in their age group is important. But look, it's so important that we recognize that as we issued guidance to reopen America now 2 months ago, 50 states are opening up our country again. People are going back to work. American everyday life is being restored kind of one step, one day at a time. I think it's important that we remind ourselves this is not a choice between the American people and a strong economy. There are profound health implications to the lockdowns through which we just passed. I heard a statistic not long ago at a task force briefing. Jurisdiction, there had been a 50% increase in the number of people presenting at emergency rooms having attempted suicide. I mean, there are profound mental health issues. There are profound economic issues, people needing to be back to work. And so our objective here today is just to make sure the American people know in 34 states, the cases are really stable, and there's no combination of rising cases and rising positivity rates. That's a tribute to the American people. And in the 16 states we're focused on today, we simply want to equip particularly young people part that they can play in stemming the rising tide of new cases. Not because the coronavirus represents a significant threat to them. In most cases it doesn't if you're a younger American, but because no younger American would ever want to spread the coronavirus to someone serious outcome. But I'm grateful for the time today. This has been helpful. And we'll be back as time goes on. Thank you.
人要講口齒㗎喎。我行遠少少，你坐返後啊，最多我哋再褪後啲啊。唔得啊！頭先冇聲啊！你講咩啊？所以我擔心。所以希望你挨返後少少，我哋就唔使擔心。返去頭先咁樣，乖啊！你聽話。我都唔俾其他人埋你㗎啦。如果你唔想我擔心嘅，你唔想我做嘅嘢，我全部冇做。我只係有少少要求，只係希望你坐返後。我哋繼續保持返呢個距離，就係咁簡單。如果你做到應承我，後啲啊，因為坐得前兩隻手分唔到㗎，褪後少少啊，好唔好啊？你坐後啲，我行後啲。慢慢褪後，需唔需要飲水、食煙？有冇需要？我哋同事有煙，一唔一齊食？挨後少少坐，係啦，挨後少少。令到我哋唔需要咁擔心就得㗎啦。咁我哋喺度確保其他人唔會行埋嚟，好唔好？係啦，都腳臂。我哋個個都腳臂，你又腳臂，褪後少少啦。嚟嘅，我都喺呢度嘅啫，錯咁解。我擺低電話嘅啫，好唔好？好唔好啊？一陣坐低個咪得咯。有人踎得耐，坐得耐，頭先都腳痹啊！應該係嗰個警員同女仔傾緊，我係咩？咁現場呢，應該就係有一名警員同嗰個女士傾緊偈啦。咁我哋現場呢，亦都係有另一名同喺另外一邊係比較聽得清楚啲對話嘅，咁我就會直接轉述返現場情況啦。邊啫？嗰邊有人踩單車。 我諗住攞開佢，你望一望我。你撳住個欄杆，我就接觸唔到你嘅。聽到啊？喂？喂？喂？聽到。唔好過嗰條界啊，小姐。頭先都係咁講㗎啦。小姐啊，小姐，我講得耐喉嚨痛嘅，我交俾我朋友同你繼續傾落去，知唔知啊？佢喺嗰個位同你傾嘅啫。冇電我電話，係啊，佢彈出嚟喎，叉緊啦。OK， 最暗。OK， 我呢邊聽到喎，我埋唔到嚟喎。你有聽到啊？我唔同你講，我聽到佢哋講嘢。我呢邊聽到啊。我唔講，我聽佢講嘢係咁啊。拜拜。我哋呢度咁多人都想關心你啊！試下話俾我聽發生咩事。係咪有好多嘢諗啊？試下講出嚟啊！放心啦，我哋行唔到過嚟㗎。我唔知。 我哋大家嚟都係想幫你嘅咋。係咪發生咗啲咩事啊？夜媽媽咁樣喺度，坐得好唔舒服係咪啊？你咁後生，我見你手臂嗱，我唔係想埋你嘅，因為你坐喺嗰度咁細聲，我聽唔到，我聽唔到你講嘢。放心啦，我哋唔會埋嚟。嗱，我真係聽唔到你講乜，我都唔係想埋嚟。試下話俾我哋聽發生咩事。我哋聽到有把女仔聲，咁相信就係嗰名女士嘅，因為聽得出佢嘅語氣都係比較激動少少嘅，啲咩具體就聽得唔清楚。而家呢旁邊有啲車聲啊，雜音比較多少少，所以聽下上邊而家情況嘅。咁但係嗰名女士呢，就聽翻頭先仲係未去到安全位置嘅。嗱，你放心啦。每個人都有煩惱。 可能會有啲嘢諗唔開、諗唔通。你咁細個，你話俾我聽。你放心啦，唔好意思，雜音比較多少少，所以未必聽得好清楚。
跳咗落去啦？
冇啊冇啊冇跳喎，未有冇喎。
恒安村嘅議員啊，唔係啊？嚇？
喂？係。上唔到去。Sorry，嚟多次青少年。負責呢一區嘅青少年外展隊呢，就已經係到咗現場㗎，但係呢，就暫時都未可以上到天橋，係咪？係啦，暫時都係未能夠進入到天橋嘅位置啦，係啦。咁再講多次啦，而家現場應該有區議員啦，亦都係有負責呢一區嘅青少年外展隊都係到咗現場㗎啦，咁但係都係上唔到天橋位置嘅。個位呢，就應該係睇得最清楚㗎啦，已經。 因為喺現雜音比較多啦，咁所以呢，暫時都未聽到天橋上面嘅對話嘅。位係一名年約20歲嘅女仔。係。係。咁現場呢，係年約20歲嘅女仔。哦，係啊，你係啦，你啊。佢講得勁快。係啊，佢話佢會再 update 我。應該喺嗰邊天橋口嘅位置。呢個咯，可以啊。可以啊，可以啊。咁根據我哋另一名記者了解之後呢，咁嗰名女士年約20歲嘅女子啦，咁就聖公會同埋青少年外展隊呢都係到咗現場㗎啦。咁而家就傾緊可唔可以派1、2個社工去上到天橋嘅位置進行了解咯。係啦，咁我哋喺現場呢，呢個位置應該就係睇得最多嘅位置嚟㗎啦。咁我哋有另一名記者呢，就會喺其他位置度繼續進行了解啦。咁如果有任何跟進嘅事項，都會即刻同我講，我會再同翻觀眾轉述翻嘅。咁根據悉指啦，咁呢一名女士呢，就係年約20歲嘅。 名涉事嘅女子呢，就年約20歲啦。青少年服務處同聖公會外展隊呢，就已經到達咗現場㗎啦，但係暫時呢，都仲未可以上橋了解到嗰名女士係咪社工曾經跟進過嘅個案啦。係啦。咁據了解呢，頭先嗰名女士呢，就係一路都未開口啦，咁就啱啱先開始願意進行交涉啦。係啦，我呢個位應該望到最多橋上面情況嘅位置啦。咁但係因為而家我旁邊比較多雜音，咁所以未必聽到上面嘅對話。
actually. I was off last night home for the first time.
I went.
Did you?
We went on a flight.
I know. Now I'm like ready to.
I think he's coming in.
咁再講情況啦，咁而家喺天橋上邊呢，就有一個年約20歲嘅女子呢，就係企跳。咁消防已經到場㗎啦，咁開咗啦。咁而家就係進行緊溝通啦，同嗰名消。咁橋上面呢，其實就已經係啦，就冇辦法上到去上邊睇到現場情況啦，亦都係唔俾其他人通過啦。咁而家咧同嗰名女子進行就係談判組嘅警員嚟嘅，咁而現場嘅亦都係由區議員啦、青少年服務處啦、外展隊嘅社工係到咗現場嘅，咁但係因為喺呢個橋上面係設立咗封鎖線啦，咁亦都係暫時冇辦法上到橋上邊進行一個溝通同埋跟進嘅。
Ladies and gentlemen, the President of the United States, accompanied by the Honorable Ivanka Trump.
Hi.
Thank you very much. Busy time.
Absolutely.
We're making a lot of progress with the whole situation that came in from a place called China, as you probably know. But we have a little work to do, and we'll get it done. We're having some very good numbers coming out in terms of the comeback of our nation, and I think it's going very rapidly, and it's going to be very good. But right now we're in that process of building, and it's an honor that you're with us today. We did it. I'm delighted to welcome members of the Workforce Policy Advisory Board. And I want to thank Ivanka. She works very hard on this board. She works very hard to get jobs. It's made in the USA and jobs in the USA. A group of your people yesterday having to do with ships. Mm-hmm. You're involved in that partnership, and it's fantastic. In Wisconsin, it was really... The Secretary of Treasury is with us, and I think he's got some very good things to say and some pretty big news. And Commerce Secretary Wilbur Ross, Secretary Jean Scalia, Secretary of Education, and Small Business Administrator who's definitely kept busy. Jovita, where's Jovita? Good. Jovita Carranza. Thanks all, Governor Kim Reynolds, who's done terrifically. Kim, hi Kim. Nice to see you. Thank you very much. And Eric Holcomb, Governor of Indiana, and we always recognize Eric because he's, how tall are you? He's a pretty tall guy, right? But we have one that's a little tall. You know where that is? Alaska. You know that, right? Good job. We appreciate it. As well as the CEOs who have signed our pledge to America. Marilyn Houston, thank you very much, of Lockheed Martin. Sebastian Thurn and Ginny Rometty of IBM. I want to thank you all from the beginning, very much from the beginning, and we appreciate it very much. Together we built the greatest economy in history and literally in the history of the world, greatest we've ever had, the greatest the world has ever seen. And now we have to bring it back because we had to close in order millions of lives. We added 2.5 million jobs last month, which was incredible, a number, the largest monthly increase in history, and more than double the previous record. So we're bringing it back. We had the greatest ever, and we had to close it, and now we bring it back, and we start off with 2.5 million jobs in 1 month. I would say that's pretty good, Marilyn, right? That's the highest ever. And then likewise, retail sales surged by nearly 18% last month. That was the biggest jump ever recorded. So that's great. The stock scene, you go back a week, 1 week, it's in its history, best 50-day increase in the history of the. Our pledge to America's workers has secured commitments to over 16 million job and training opportunities from employers nationwide, and some of the employers are with us, and they've been. I want to thank the American people for doing such an incredible job. They understand what's happening, and they see how fast we're. Just state that this is Americans of all backgrounds that we're talking about. To have the chance, we want to get them the chance to learn a successful career. We want to train Americans, and we want to hire Americans. So we're training American, and we're hiring American. Before the pledge, and this is a very big fact, a problem that has about 22 different names, but I'll just call it the plague. But before the plague struck, we had the lowest African American and Hispanic American, Asian American unemployment, most jobs we've ever had, almost 160 million jobs. We've never been in that. Women were thriving, best numbers ever. And since my election, more than half of those jobs, more than half, first time that's ever happened, went to women. But now we want to get that all back. The African American group got hit very hard. The Hispanic American group got hit very hard. All groups got hit hard, but now it's all coming back. To further expand opportunity, I'm taking a bold action to reform the federal workforce. Today, I'll sign an executive order that directs to replace outdated and really outdated, it's called hiring with skill-based hiring. So we want it based on skill. The federal government no longer be narrowly focused on where you went to school and the talents that you bring to the job. We want that skill to be there. We want it based on, we've looked at merit for a long time, and we've been able to get that done. And today's signing is a very, very important one. Before I sign, I'll ask Ivanka to say a few words, and then we'll go around a little bit. We'll pick a few people, and then we'll sign, and we go back to work. Thank you very much. Ivanka.
Thank you, Mr. President, and it's an honor to have you here. We just convened our 6th Force Advisory Board, and we got an update on the team's response call to action. First, we're going to be launching, and Ginny Rometty, in partnership with Tim Cook's, a massive advertising campaign that directs those that need to reskill, learn a new trade, to secure a job, to the resources to enable them to do that. So we're very excited about the launch of this private sector-led and driven campaign to match American need and ultimately the job vacancies that exist. The advisory board is also a series of pilot programs, and Scott Pulsifer and Doug McMillan have been running these groups where we really think about how we create the resumes of the future and allow people to find job vacancies based on skill, and for employers to connect with those unemployed workers, again, based on skill. So creating a lot more to that process. You are once again leading by example here today with this EO signing. As the nation's largest employer, we are always seeking to recruit and retain the best and the brightest to serve the American people. Last for and secured paid leave for every federal worker. This was a first that reflects our American values of both work and family, and helping us retain our amazing talent. It's also why you fought so hard this spring when COVID struck to secure paid sick leave for Americans employed by small businesses and additional funding for child care providers, helping millions and millions of Americans and providing relief to small businesses across the country. This is going to ensure a faster and stronger recovery. Today, we're taking that next step, as you mentioned, and signing an executive agencies to hire based on skills and knowledge, not requirements. This will allow us to better recognize the talents and competencies of all Americans we hire. You built once the most inclusive economy in this country's history, and you'll build it again. Through our Pledge to America's Workers, the private sector has committed to training and education of over 16 million American students and workers, despite the vast change that the plague ushered in. Companies like Udacity, Sebastian Thron joins us today, have been leading the way, and they've been using their pledge commitment and fulfilling it by providing free tech training to American workers laid off as a result of COVID. I recently had the opportunity to virtually meet one of the students that received your scholarship in conjunction with the pledge, and it was incredible. His name was Tony. He was a lifelong truck driver. He owned his own business. It was a single rig that he had. Through a series of setbacks, the company ended up going under. He signed up for a course in tech and is now a software engineer. Family absolutely loving what he does. And there are many like Tony that hopefully will inspire millions across the nation. Marilyn Hewson, also an early pledge signer of Lockheed Martin, committed to hiring during the pandemic, using virtual and other techniques to ensure recruitment processes move forward. So with more people teleworking and learning from home than ever before, we have a lot to accomplish in the months ahead, and I'm really excited about it to extend this working group and to reform our federal hiring practices as we think about building that inclusive American economy as we transition to greatness. So thank you for today, and it's a pleasure to have you join us.
Thank you very much, honey. Great job. Really has been. It's been a labor of love, and Ivanka loves helping people. Marilyn, how about starting with you?
President, it's really an honor to serve on this policy board, and I must say I agree with you. Advisor Trump, Ivanka Trump, and Secretary Ross have led us well. We've had a great effort over the last several meetings and put forward some strong recommendations that I help to match the skills together with the job. At Lockheed Martin, we're proud that this year we're on a path to hire 12,000 people, and a lot of it is around making sure that we are getting the kind of apprenticeships and scholarships and skills training for them so that they can link up to jobs in our operation. Thank you.
When I got to see it again, I mentioned it was so impressive what I saw, the whole group yesterday was really great. I didn't know you had a big chunk of that one, but you've done very well with it, so we appreciate it. Please, Sebastian, please.
It's a great honor to meet you, and I want to thank you for keeping us safe and moving us forward. This has been a lot of us, with over 30 million unemployed. It's our chance to really redefine how education looks like. Move into a world where people learn lifelong, have lifelong access, and can really unfold their livelihoods. Ivanka, who's of course the visionary behind all this, and thank you for mentioned Tony Boswell, a truck driver who was driving trucks for 10 years now, and he couldn't finance the new engine that he needed. He was unemployed, had no income, no education. By randomness, a Google scholarship that Udacity launched, and then in 10 become a software engineer. These are the stories that I believe this nation needs. I think we have so much opportunity, so much potential in this great nation to bring people forward, and I think this is the time to do it.
That's a great story. It's a great story, amazing story. Ginny, please.
Well, first, Mr. President, thank you for your leadership during this time. And you used an important word when you described contribution here as a labor of love, because this is something I think what the team has done collectively will have a very long-term impact, as well as short-term. And we are solving being solved one of the most important programs for growth for the country as well, from any socioeconomic background. So I really, my hat is off, and a thanks to Secretary Ross, Ivanka, for having led us through this. And I think what we've put on the table is substantive change, and it is change to a company like mine. So as you sign Skills First, 15% of our hires last year were people from non-traditional backgrounds. And so it's really what this is all about, I think, and giving everyone a bright future in the digital era. So thank you for that.
Thank you very much. Good job.
Thank you.
Eric, go ahead, please.
Well, I'll just add my appreciation. I mean, what you're doing is leveling the playing field. And there's been a lot of people, a lot of have-nots that will have an opportunity and to to do it during a time of such challenge, but to recognize the opportunity that's here and to do it now, there couldn't be a more important time. So appreciate everyone's effort around this table and your leadership on this front.
Indiana's doing very well, I'm hearing. Good things.
We are moving in the right direction. We've got 93,000 unfilled jobs right now that we need to fill. We've ushered in 100,000 jobs in just 3.5 years. The previous record was 93,000 in 4 years. These are high-wage, high-demand jobs. These are $28 north an hour.
That's great.
So this is what it's all about, skilling up the workforce. Thank you.
That's great. Great job. Thank you very much. Kim?
Well, thank you, Mr. President. And what I so appreciate about your administration is it's really an administration of action. You identify barriers and gaps, and then you help bring the right people together to find this. So thank you very much. It's been an honor to be a part of this advisory board. How, with the leadership of Ivanka and Secretary Ross, we really have identified the various elements, whether it's been consistent data, definition, and I look forward to really amplifying that in the state of Iowa. By executive order, I just created an economic brought several CEOs, business leaders, and nonprofits together to utilize their expertise through innovation and adaptation and creativity, adjusted within weeks to the coronavirus. And everything that this group has told so well into what we're trying to do at the state level. And when you think about that happening in every state across the country, we really are going to come back stronger and better and really help provide opportunities for every single American. So thank you for leading it.
And we see it now, Kim. Next year is going to be, we think, amazing, actually.
Yep, I agree.
It's going to be an amazing year. Larry, would you like to say something?
Yeah, thanks, sir. I spoke just before you came, but I'll just repeat the V-shaped recovery. Virtually every number is showing a V-shaped recovery now. Private surveys, government statistics, restaurants, home builders, truckers, durable goods makers, Apple Mobility and Travel, gasoline demand. As you said, the jobs went up really in May. We had tremendous retail sales. And the income report, we had tremendous consumer spending, 8% at an annual rate for 1 month. It's a great story.
That's a great number. Yeah.
And I still think we'll get 20% in the second half of the year. And if we get another 5% in the first quarter of next year, we will be right back to the peak in 2019, where you got us the first time with the growth policies. And I just want to say, Ivanka, I gave you a big pitch, did the best I could. Private sector reskilling and retraining. And not only will people come back to the labor force when they're reskilled, they'll come back with higher wages, and they'll come back with more confidence. And it'll make a huge difference and so I've added you to the 4 pillars of growth, the President.
Good.
Tax cuts.
Good taste.
Deregulation, energy unleashing, fair trade deals, and private sector-led reskilling. How's that, sir?
That's great. That's happy what you said about early next year. I think next year is going to be an incredible year. Thank you very much, Larry.
Appreciate it.
Wilbur, would you like to say something?
Yes, Mr. President. Thank you for the opportunity to help Ivanka and the others on this group. I've been very, very impressed with the productivity of this advisory board. Most advisory boards create a big, thick book at the end. It goes in the library and nothing happens. This single meeting, there's a specific, tangible thing. It gets followed up and it gets implemented. So it's really been a heartwarming thing to see how productive these folks have been. And I congratulate all of them.
Thank you very much. Thank you.
Thank you, Mr. President. 3.5% unemployment rate just a few months ago. You did so many things for the American worker during those 3 years. You know, back in the summer of 2016, the Congressional Budget Office said that we'd be at 5% unemployment in February. They said that between then and February 2020, they said 1 million jobs. We created 7 million jobs. So Larry touched on it. It was tax cuts of deregulation that brought us there, which was just a wonderful thing for the American worker as jobs were being created, wages were rising. But there was other work going on, and what you see today is a manifestation of other things that were being done that are now going to have their day to really help. Coming back, Larry's mentioned some of the numbers. But we know that the training will be important, and we're fortunate that this really very extraordinary group, and as Secretary Ross has said, a group that really generated valuable product. They were working quietly to help train American workers. I spoke about a new apprenticeship rule that we adopted at the Labor Department that I think will be very helpful. This will be an important part of the rebound.
Thank you, Gene, very much. Appreciate it. Steve, please.
Thank you, Mr. Others said your economic team, working with you, knew how to create jobs, and it created an enormous amount. And because of this virus, we had to unfortunately shut down the economy. We know how to reopen the economy safely. Working with Congress, we put $3 trillion in. It's beginning to work. We see it. And where our work isn't going to one of these jobs is done. We know we need a few more Congress next month, but we're going to get everybody back to work. And I'm confident we're going to see a strong third and fourth quarter as we reopen.
That's great, Steve. Thank you very much. Anybody else would like to say something? Anybody? Anybody? Go ahead, please.
Mr. President, I just want to say as your chief what an extraordinary day today is, and here's why. It's not just the work of this council and the leadership of Ivanka. It is the executive order that you are about to sign that completely resets the playing field. The federal government is the largest employer in the country with 2 million employees. 2/3 of American adults do not have a college degree. Your signature that is recalibrating the workforce only to skill set is transformation opportunity for you to fight for all Americans. I think about Tony that Ivanka talked about from Udacity, from a truck driver to a software engineer, next potentially because of this executive order that is focusing on skills rather than degrees. Congrats for your leadership. It's extraordinary.
Thank you very much. Anybody?
Yes, President Trump, thank you very much for your strong leadership. You know, I sit here as part of a participation of this particular board, and I'm a recipient of the type of programs that you are actually implementing and supporting. I started out as a box handler in a world's largest logistics company, and so when I hear talk about the dedication of the workforce, comprehensive training, I took advantage of every training opportunity there was in that project, and perhaps you'll see another administrator similar to me based on the programs that you're going to advocate and support. And because of the public-private partnerships that this administration has enabled, the Paycheck Protection Program, just one example that has small businesses sustained their viability and also protected their employees, a baseline of about 60 million employees. And so I thank you again, businesses front and center. And one other comment, I'm looking at all of these private sector super leaders in your various sectors. You are the primary contractors for contractors that I represent as an advocate for small business administration. So once you reinstate your viability, the small business sector will then follow soon after. So thank you again, President.
Thank you very much, Jovita. Thank you very much.
Mr. President.
Please.
I just appreciate your unrelenting focus on creating opportunity for all Americans, and that begins with opportunities in education, and I so appreciate your leadership there, and it's been a privilege to be part of this. Ivanka and Secretary Ross, thank you. Your work here, we are privileged to carry out in policy and action as Governor Reynolds. Thank you for your leadership.
Choice, how's that going? Choice, yes. Right? That's what we want. Please.
Yeah, I was just going to say, thank you, Mr. President. From a university's perspective, perceived as skills versus degrees, but in reality, in a skills-denominated future, it is that votes, because even those who possess degrees, they can better articulate the skills and competencies that they now have for the future. And the reality is, too, is that it's also more full, it's more prosperous for our workforce, because what it really is it's now about what you demonstrate, not how you acquired the competency and skill. Right. And so it just creates much more of an equitable way. And WGU, as a competency-based education provider, has always been articulate the outcomes of achieving a degree in a skills and competency-based way. So it's much more aligned with the future of work. And so it is truly that tide that lifts all boats. So huge step in the right direction. So thank you very much.
I agree with you 100%. I do. Okay, why don't we sign? And this is a big deal. Congratulations to everybody in the room. Okay, we'll do that one. we'll take this. Thank you very much. Okay. We have pens for everybody. All right, phase two. Thank you very much. Well, thank you all very much. We appreciate it. This is really an important day for a lot of reasons, but this is one of them. Thank you all for being with us. We appreciate it very much. Thank you very much.
Why'd you care?
The numbers out of Florida and Texas, did they open too soon?
Outflow 咗添。OK 啊，所以都 OK 啊。談判專家，補充翻就係橋上面嗰名呢係談判組嘅警員嚟嘅，係啦，就話係談判組嘅警員。咁而天橋上面嗰名呢，就係一名年約20歲嘅女子啦，咁暫時未翻去一個安全嘅位置啦。咁天橋呢都係封鎖緊，咁社工啊、區議員啊或者任何人士呢都冇辦法係通過呢條天橋或者係接近到事主啦。
少正面啦，咁所以張相都會揾社工嗰邊望一望。
好啊，好啊，好啊。
我過一過去。
嗯。 咁有觀眾我情緒或者有任何煩數嘅話咧，都可以inbox 我哋傾下偈，我哋都會同你盡訴心中情。係啊，或者可以聯絡一啲社工幫手都可以，係啊。咁起碼講出嚟舒服啲啊嘛，啱啊。據了解呢，今名事主而家呢條橋嘅正中間欄杆內面嘅位置咯。咁但係我哋呢度已經係瞓㗎啦，即係已經係最理想嘅位置㗎啦。有另一名記者呢係會喺另一邊了解情況，再同我講，咁我就會再轉述俾。
He was being fitted for ruling the state, in the words of his biographer.
He was ruling the state, in the words of his biographer.
He was being fitted for ruling the state in the words of his biographer.
He was being fitted for biographer. He was being fitted for ruling the state in the words of his biographer.
He was being fitted for ruling the state in the words of his biographer.
He was being fitted for ruling the state in the words of his biographer.
And the firebugs can't think of the right name subsidiaries. This is apple.
This apple. This is a big red apple.
This is a big red apple.
This is a big red apple.
This is a big red apple. This is a big red apple.
咁見到其實現場嘅消防員同埋消防員亦都係已經開咗氣展啦，咁已經係做好準備啦。咁而家都仲係同嗰名事主咧係進行個交涉咯。
竟然賣緊一啲
呢個係警員嚟嘅。哦，好。咁咧就有一名談判組嘅頭係買一啲飲品嘅，咁相信都是嘅。
談判組嘅 談判組嘅人士亦都同本台嘅記者即係其實係我哋啦，咁就去透露就話而家個情況仲係談判緊啦。唉，我等佢過咗先。
哦，好。
係啦，咁而家情況中咧，咁亦都佢話係佢唔能夠確認，即係下邊一啲疑似可能認識佢或者本身已經係同佢有交流嘅社工係唔能夠確認佢帶咗佢上去之後會唔會傾得好啦？可能都佢話有咁嘅情況啦，即係有咁嘅顧慮啦，所以會同翻當事人去傾翻嘅咁樣。咁而家佢亦都進度就係阿妹妹亦都願意同談判組嘅警員咧就開始有一啲溝通，咁就所以談判組嘅警員咧啱啱亦都係買咗一啲當事人係希望想飲嘅一啲飲品，咁就咁個進度就係咁樣。係咯，咁我過翻去，你要用翻啊？
我需要。
因為我驚你又跌電喎。
呢台記者係咪長住馬鞍山？唔係，各區都有記者嘅。咁如果各區有突發嘅話，我哋都會去。咁所以如果觀眾有任何報料咧，亦都歡迎報料話俾我哋知啦。就唔係淨係馬鞍山突發會出現嘅。係啦，咁橋上面咧而家談判係
有同事喺土瓜灣。
係啊，頭先先至有同事喺土瓜灣開咗呢個突發嘅直播咯。係啊，咁而家橋上面嘅位置咧就係談判啦，即係談判組嘅警員都仲係進行緊談判嘅。處理緊呢個 stabilizer， 所以可能畫面會有少少震嘅。我放手。
等，推入去。得。喂，其實會唔會 set 腳架喺呢一度？好似就嚟，你有腳架咩？好細嗰隻架咯，得唔得？試一試咯。揸住啊！
原來有腳架，
好細喎，登機啊！
咁天橋上面嗰名咧係一名女。哦，頭先係30。
唔理啦。嗱，咁我而家咧就嘗試將個鏡頭
放喺個
位置。喺度講嘢，我試一試。
哇，好高喎！我都睇唔到佢哋講咩。呢個距離我睇唔到佢哋講咩。
唔緊要啊，我打你而家先。
咁而家咧？橋上面咧，仲係進行緊呢個談判嘅過程啦。咁就社工都仲係未上到去橋上面嘅。咁而頭先談判專家咧，亦都係落咗嚟為審啦。咁亦都係進行緊一個交涉嘅。得唔得啊？我驚聽唔到啊！太好了。
係。但係如果你攰嘅話，就拎翻住，可能挨一挨。
我要咁樣講嘅。
或者 set 喺地下都唔得。
但係我哋個腳架唔夠。 喺橋上面嗰名涉事嘅呢，就係一名20。咩啊？揾到啊？就係有冇上到去？咁你拎住啦，我諗。係咯。我攞住啦。放翻嚟呢度啦，嗰邊。係你走啦。即係見一個啦，咁應該聯絡緊佢嘅家屬。哦，好好。係。好好好。咁有消息指啦，就係有社工已經係應該係知道呢名女士嘅身份㗎啦。咁試睇下可唔可以聯絡到佢家屬，係揾到佢哋嘅家屬啦，揾到佢嘅家屬。咁希望是可以盡快返去安全嘅位置啦。咁我哋都好擔心佢啊。咁有消息就話啦，有社工已經係認到呢名女士係邊個㗎啦。咁就嘗試係聯絡緊佢嘅家屬咯。而家時間已經係凌晨3點40分啦，咁嗰名女士咧都仲係未返去安全嘅位置啦。社工係好似識別到嗰名女子嘅身份㗎啦，咁就而家嘗試可唔可以睇下聯絡到佢嘅家屬啦。咁都好多謝咁多位觀眾同我哋一齊喺度了解返現場情況啦。咁如果觀眾有任何情緒問題啊或者做嘅話咧，咁都可以揾社工啦，或者 inbox 我哋傾下偈都得㗎。仲有 Open Up 勁方便咯，佢係一邊嘅網上外展平台，咁佢就社工會係當值咁樣，可能用文字已經可以覆到大家，幫到大家做一啲好初步嘅一啲情緒嘅介入。係啦，咁面對呢啲情況啦，咁我相信壓力同埋一啲唔開心嘅感覺一定會有啦，但係一定係啦，要同人傾下。係啊，呢個亦都係傳媒嘅責任啦。當我哋去報告呢件事或者直播俾大家睇嘅時候，都希望大家係能夠喺情緒方面都喺下邊有一個支援，都希望唔會係一啲傷害或者係影響。領帶啊，嗱，我頭先已經問過啊，因為其實我哋就冇即係唔係 Open Up 嘅正式打手嚟嘅，咁所以咧。一般嚟講，我諗有揾到嘅話，我諗佢都會做到一啲即時嘅咁進一步，如果有需要嘅話，都應該會轉介嘅。咁如果你講話係我諗明愛都會係一個較容易打得通嘅，因為我試過，即係我哋試過就有啲熱線就可能未必係24小時啦，或者係繁忙。咁網上外展 Open Up 咧就係24小時嘅。咁另外亦都除咗東華三院啦、明愛向晴軒啦，都仲有一啲選擇啦。咁有需要嘅話，可以 inbox 我哋。係咯。好啊。
快嘅冇呢條，唔係有呢條線好似，但係你會好辛苦啊！你要拎住再對。開心嘅嘢，聽日要做聽日有，好玩啦今次。唔好意思啊，個鏡頭有少少震，有少少會唔穩定。
又點喺我度？呢度。猜緊啊！而家先猜緊。佢唔會顯示㗎。
放緊屏。
唔知而家嗰邊情況點？
邊邊啊？
上邊咯。
嗯？
上邊。
上邊我諗暫時都唔知啊，但係就可以確認，即係有談判組嘅警員都傾緊。咁而下邊嘅情況就係都有社工好焦急、好擔心咁喺下邊做一個。咁但係戰就個氣戰就已經喺下邊橋下邊嘅位置就準備㗎啦。
呢度唔會顯示差緊嘅，正常㗎，咁樣係。
揸住。
哦，揸住。
我唔肯定。你當年。
好啊好啊，唔該。情況都應該係橋上邊嘅談判組警員喺度進行緊談判啦，咁而社工亦都係一路定嘅位置做準備啦。咁有消息指啦，咁係有社工係辨識到嗰名女士嘅身份嘅，咁係啦，係啦，咁亦都係嘗試聯絡緊佢嘅家屬啦。好啊，唔該你。咁我哋另一名記者咧就會解橋上面嘅狀況啦。 收嘢嘅喎，但係我哋唔可以，係啊，OK 咁。感動啊！有一個街坊咧就過咗嚟問，即係想俾啲支持我哋啦。咁但係因為我哋公司規定咧，就唔可以收一啲人士嘅物品啦。咁所以都好多謝咁多位街坊對你哋嘅 like 同 share 同 follow 度，就已經係我哋嘅動力係啦，動力係啦。咁心意收到晒，多謝大家。
聽唔到。
咁我就好感動。
哦。
但係就
咁個觀眾咧，
已經
叫佢早啲休息。
係係啊，心意收到晒。
而家個情況都穩定。咁其他嘅資料，唔係，因為咩嚟㗎？
咩啊？冇啊！佢咁問啫。你繼續講啦，去到邊啊？
即係其實而家情況應該都穩定嘅，咁見到即係咁，但係就都穩定嘅，咁亦都暫時喺呢度，我哋會繼續直播啦，繼續睇。咁但係當佢安全嘅時候，我哋就會刪直播啦。但係我哋唔會去攝影當事人嘅樣貌，都唔會公開當。咁就情況就去到咁樣啦。啲人個情況，我哋都喺冇必要嘅情況之下，我哋都唔透露啦，係啦。 買蚊貼嗰。公司應該即刻改 policy 咯，蚊貼係可以咯。係啊，蚊貼係可以，聽唔聽到後邊？
咁都得嘅咩？
冇計。
馬鞍山係一個好好嘅地方。咁而家已經係4點鐘啦，咁但係嗰名女子呢都仲係未返去安全嘅位置啦。咁但係現場嘅情況呢都係穩定嘅。咁都好多謝觀眾，而家都一路睇住我哋 live 去留意翻現場情況啦。咁有觀眾有任何情緒問題或者有啲咩想傾訴嘅話呢，都可以揾社工或者 inbox 我哋傾偈都得嘅。
處理緊 inbox 嘅情緒支援啊！
有啊。
有人係社工嚟㗎，所以情緒支援方面都可以。
我喺度啊！我喺度啊！ 啲橋上面嘅警員似乎對我哋非常之好。個女仔而家暫時都係未返到安全位置啊，咁但係橋上面都仲係冇辦法上到去啦。咁但係現場呢，咁就情況都係穩定係啦。咁我哋都會繼續喺度跟進返現場情況啦。會啊。點啊？
就係橋下邊可能認識啲社工都比較輕鬆啦，咁都而家個情況落應該就個進度都係理想嘅，係啊，因為其實佢哋嗰邊都喺度玩緊。係啊，咁所以我諗都相信唔需要太擔心咯。咁返工嗰啲唔係嘅，雖然我哋好需要個 view 數，但係我覺得返工嗰啲都早啲瞓覺，
早啲休息啦，可以睇重播。
係咯，可以重播好多次，
冇錯，
冇限制嘅。呢個位似乎就即係大家都可以叫做。其實都唔可以講我鬆一口氣，希望真係即係我哋另外一邊個鏡頭要睇到開咗，即係入翻嚟呢一個欄杆，我哋先能夠叫鬆一口氣啦。係啊，冇晒電啊？
唔係啊，我想 hold 住啊。
哦好啊。黐線。
唔該。
喂，需唔需要噴下仲？
要啊。很多蚊。
或者咁樣去解釋啦，我哋留意到有唔同嘅意見啦，但係其實我哋係一個傳媒，咁其實我相信就算佢嘅言論或者佢嘅諗法係點樣都好，我哋都有一個責任去，唔係我哋就我哋係用住公眾嘅授權啦，咁去使用第四權利去為公眾披露真相啦。咁相信任何人可能有一啲嘅言論或者係一啲唔太即係被大眾所認同嘅言論啦，但係其實我哋都需要向佢提供，或者佢哋都有個對於新聞、對於而家事實嘅事嘅一啲知情權，所以我哋一直都冇去封鎖某啲可能具冒犯性嘅言論，係因為我哋每一個人佢有自己嘅言論自由，但係我亦都會保障翻呢一個本身由大眾授予嘅一啲新聞嘅權利咯。所以希望大家如果即係有啲言論，希望你哋可以唔睇啦，或者係去唔理會佢啦。咁但係我哋都就算係咩人，我哋都要向佢去披露呢一啲嘅事實，我哋唔可以去封鎖佢。你嗰度睇應該會好啲。嗱，不過喺呢度都提返大家啦。雖然網上邊呢其實就有隱密性嘅，咁但係有啲事情啦，其實喺網上邊唔係所謂香港法律嘅一啲限制啦，可能例如一啲具冒犯性或者係一啲可能嘅嘢呢，其實喺網上面講呢都會有問題嘅。咁希望大家可能真係講要考慮返自己會負上一啲可能會負上一啲責任咁樣。做咩啊？好啊。去留言啊！我真係覺得有啲係一啲言論自由嘅嘢嚟，咁我哋作為傳媒嘅角色，真係希望大家可以幫幫手 block 啦，係咯。同埋其實我哋有啲可能冒犯嘅言論啦，有啲可能甚至乎令到記者姐姐都會睇落唔舒服嘅，咁但係我哋都即係去 block 佢啦。即係一就係你 block 得幾多呢？咁嗱，第二就係反而佢講完嘅嘢係咪有需要去負責呢？係咯，你點睇啊？其實對於一啲可能喺我哋嘅留言裏邊，
我嘅留言做咩啊？唔同政見嘅人士，
或者可能係一啲觀眾封鎖某啲人啊，定有講完嘅有冇補充啊？
覺得你講得好好。
哦，多謝你。
係啦，有言論自由，所以唔會去封鎖佢哋講嘅嘢啦。咁如果覺得唔舒服就無視佢哋。
同埋或者咁講啦，有人喺網上面講呢一啲言可以去嗱，既然網上面有人講呢一啲嘢出嚟，咁其實即係有人有呢啲睇法，佢不嬲有唔同睇法係好正常。咁會唔會趁我哋呢一個直播，既然大家都喺呢一度實時去同大家睇緊同一件事、關注緊同一件事嘅時候，可以趁呢個機會做個交流，可以了解對方嘅感受，或者了解對方。係啊，即係你可以和而不同，即係睇你點睇啦。即係繼續惡意去互相罵戰係冇意思，但係反而互相了解、互相探有趣嘅做法嚟，係咪咁講？ 劉明睇記者夜咗語無倫次。
咩啊？佢講㗎？
哦，唔係啊，
我以為笑咗。係咪真係 OK 㗎呢度？
嚇，唔 OK 都冇計㗎喎。
係啊，唔係就係如果佢唔 OK，我 hold 住先咯，費事
可能
陣間。
似乎佢係一路叉緊部電話，就再用埋自己 stabilizer， 咁就唔夠嘅 support 佢。
好啦 ，OK。
相信係咁啊。
可以啊，可以啊。
前線
係啊，我哋啊！
揾你哋牽出
做咩事啊？做咩事啊？
我哋唔可以啊！多謝，但係
咁嘅麥當勞有袋咯。
嗱我不如
媽媽有1000蚊㗎。點啊？你話好多蚊啊嘛係咪？
我哋
有啦。
唔緊要啊，唔緊要，我哋睇下有冇啲有需要嘅人，我哋俾佢啊，好唔好？
唔緊要，你口渴飲下邊嗰啲啊，翻嚟你俾人啦。
好啊。
飲
唔係我哋 OK 嘅，係啦，我哋非常之多謝。
多謝你啊！
飲啦。係
啊，我哋好啊，咁多餘嘅物資我哋就睇下嗰邊嘅社工為佢睇下有冇需要啊。辛苦晒。
咁天。
係啊，唔緊要啊，唔緊熱啊。
係啊，啱啱整啊。
快啲休息下啦。
冇事啦，嗬。
咁夜仲要。
睇到瞓唔着啊！
瞓唔着啊！我
又聽到你哋講又話好多蚊，我又唔知你哋。
我哋係唔應該講多蚊啊！下次我哋一定話冇蚊啊！
係啊，好係啊。
嗰邊冇蜈蚣咯。嗰邊冇。
係啊，冇蜈蚣冇蚊。
冇事啊，暫時我見到即係現場可能啲社工。
我哋唔食麥當勞。
慢慢行，咁我相信個情況都理想。
都係因為有觀眾支持我，都係好多謝大家一路同我哋留守現場情況。
同埋呢個位又衰啲嘅，呢個位好難。
我淨係認得你個頭個 capture 係呢個位咯。係啊。所以我沿住呢度行過嚟咯。如果我知係呢度，我就下次咧，
我哋通常咧喺同埋上邊你試下 fresh 一次嗰個 description。
即係你哋呢個網。
係啦，我哋入嚟個 description 咧，其實係我哋會 keep 住 update 個位置同狀況。
哦，我 set 咗啦。我就係 set 咗，我頭先係睇另外一部電話嘅，後尾因為我要落嚟嗰部電話就開唔到個網嘅，所以我用翻自己嘅電話。
數據㗎。係啊。好，咁我唔使 share 俾你。
因為我平時睇咧係今日佢哋嗌我睇話因為我平時睇開都係睇全民嘅嘢多。
唔緊影到個鏡頭就。
係啊，咁但係今日我見呢個位我一路睇到而家未停過。你有嘢
真係唔開心就，但係我哋有啲即係有啲渠道嘅。但係真係唔開心，記住揾人傾偈。我哋都有人喺度負責覆緊。
睇個意思睇緊醫生嘅。緊齊嘅，你俾人食啊一係。
好啊，我睇下佢哋。我嗰邊都仲有社工嘅，我睇下會唔會佢哋。好啊，好啊。佢哋有啲過咗去呢一邊。
呢度都見得翻 過去㗎嘛。係啊，呢度穿過去嘅。你去邊啊？
多謝多謝。係啦，咁好多謝咁多位觀眾我哋嘅支持啦，係啊。
阿英啊，認得你兩個把聲㗎。嚇？邊係咁？
多謝。
好啊，辛苦晒。
認得我把聲。係啦，咁好多謝各位觀眾嘅支持啦。咁但係我哋係唔食麥當勞嘅，不過都多謝大家嘅支持。係啦，我哋可能會將啲嘢食咧，就即係將啲心意可能會俾隔離一齊留守嘅社工啦。哦，唔使啊 ，OK 啊，唔該你。係啦，我哋頭先咧聽到天橋上面咧係有人講話企返入去咁樣嘅。我哋已經係最理想㗎，因為天橋嘅位置咧係冇辦法上到去進行採訪啦，而且亦都唔想影到當事人嘅樣，咁所以咧我哋暫時都會喺呢個位置度影嘅。咁似乎橋上面就係進行緊一啲交涉啦，咁但係我哋就聽清楚具體內容係乜嘢嘅，咁我哋都盡量聽下佢哋講咩啦。上面係咪有車過？佢哋係咁喺度講嘢。
頭先聽到係有少少聲音㗎。
係啊，但聽唔到講咩。
聽係一個男仔聲。
喺上面咯。
消防員如果係嗰度全部聲都夾咗落嚟㗎。消防員組成嘅男仔。我又入過去公鬥嗰度。聽一聽他聽。
好啊，好啊。 時間就係4:27啦，差唔多4點半啦。咁都好多謝咁多位我哋一齊喺度關注現場情況啦。係啦，咁如果今日嘅觀眾就早啲休息啦，可以睇重播。如果唔係，聽日返工冇精神啊！今日返工冇精神。係啦，咁頭先聽到橋上面呢，就係似乎有啲聲音啦，咁就有另一名嘅記者呢，係去近啲嘅位置，睇下聽唔聽到佢哋講咩嘅。聽唔聽到？
好清晰嘅內容啦，但係我哋都聽到其實個對話都比較單一，就係可能由警員去講啊，或者發出，即係其實都冇一個雙向溝通。
即係都係警員。
或者缺乏一個雙向溝通咯，咁樣講，即係似乎即係面嘅事主其實都仲未係願意去分享，或者未準備好自己去分享呢件事。係最主要嘅聲音。
好 ，OK。咁相信橋上面嘅警員係嘗試同嗰名事主係進行溝通啦，咁但係聽翻個對話，似乎都只係一個單向溝通啦。咁事主似乎都仲係未去同警員或者同其他人係分。係啊，觀眾嘅心意我哋都收到晒㗎啦，咁係啦，始終公司規定我哋唔可以收出品啦，咁係咯，咁所以頭先嘅一啲咧，我哋都嘗試係分享俾其他同我哋一齊留守嘅社工，係啦，咁但係心意收到晒，多謝大家。我哋都一路聽到咧，橋上面係一把男聲咧，應該係相信係進行緊一個或者可能係一個溝通咯。 我冇食嘢啊，唔係我啊，我哋都冇食嘢啊，係純粹旁邊嘅一啲雜音嚟嘅啫。依我哋又見到嗰名談判組嘅警員又跑落去呢個天橋。我哋咧見到旁邊咧係有係駛入嚟呢個油站嘅位置啦。我哋望先。
回應有冇跟㗎？大家
咩回應啊？佢哋研究緊氣炸鍋啊！
嚇？點解嘅？
講緊薯條好似係。
講緊薯條啊？
好似係。
薯條，我覺得 Five Guys 嗰啲薯條真係勁好食。
薯條。哇！咩事啊？係啦，咁見到天橋上面咧，似乎係有啲事。咁我哋另一名記者而家就衝過去睇下發生咩事啦。係，我哋聽到上面咧係有人係叫佢慢慢嚟嘅，咁亦都聽到係有名女聲係叫緊啦。咁似乎橋上面係有啲事情發生咗，咁但係我哋呢個位置又睇唔到。我哋另一名記者呢，就係去了解緊嘅。線一線，係。係，即係欄杆咩嚟？
用手號啦，冇計，佢冇電。係啦，咁啱先啦，咁仲喺度嘅觀眾就係啦，咁就而家個情況咧就係、事主咧去呢一個欄杆入邊㗎啦。
擾攘就係
都唔重要啦，係咯，總之就而家
係啦，總之而家係啦。
係啦，咁就係由消防員捉住佢，係拉翻佢入嚟嘅，係啦。咁然而就見到救護車頭先喺 嗰個位置亦都洗前咗啦，係啦，洗前咗應該相信就準備之後戒備係會唔會係有受傷或者係需要去送院嘅。咁然而見到氣展呢，其實已經係放緊氣㗎啦。係啊，我諗瞓覺嗰啲可以即刻嘈一聲咁樣，係咯，因為大家聽日可能再睇我哋 update 啦，係啦，因為都真係考添，真係好夜啦，唔好考，係啦，真係好夜啦。咁就係咯，涉事嘅人士啦，其實已經。可唔可以幫手繼續聽一聽上面講嘅嘢啊？我哋聽係一把女聲嚟嘅。你喺呢一度重複一次啦，10% 嘅啫。你喺呢度重複一次之後就刪直播，盡快，因為我哋要 save 翻條片掉翻上去，仲要。係咯。咁簡介一次，由頭。
係啦，咁我哋就今日凌晨1點幾左右，係啦，凌晨嘅時分咧，咁就收到有報料啦，就話喺呢個位置咧係有一名女士係企跳啦。咁據了解咧，就有一名年約20歲嘅係喺呢個天橋嘅位置係危坐咯。咁而家嗰名女士就已經係喺佢安全嘅位置㗎啦。係啦，咁我哋暫時都係咪點？暫時嘅直播可能會有機會影響情緒啦。咁所以如果你哋嘅情緒狀況或者係一啲情況需要支援啦，係啦，咁呢個可以隨時聯絡翻嘅社福機構嘅一啲熱線啦，或者係可以我哋提供一個渠道，就係而家夜晚24小時啦。咁會有賽馬會提供嘅 Open Up。係啦，咁就呢一個係24小時嘅網上外展服務嚟嘅。咁一啲好即時嘅情緒上面嘅需要呢，都可以一啲渠道呢去講，就千祈唔好收埋啦。係啦，咁而家應該就事主呢，其實應該就已經係解除咗佢本身喺嘅位置嘅一個危機㗎啦。因為而家就已經入翻去欄杆嘅位置。係啦，咁直播就暫時去到呢一度。如果啲咩突發嘅事情呢，我哋都會有一啲 update 或者係按需要咧去決定會唔會開翻個直播嘅，係啦。咁而呢條片亦都會upload 翻落去我哋而家睇緊嘅一個平台上面啦，係啦。咁就多謝各位，喂，埋尾啊！埋尾！多謝咁多位觀眾嘅支持，仲同我哋一齊留守現場，咁好多謝大家支持啦。咁如果觀眾有任何報料咧，亦都歡迎係報料嚟知啦。咁我哋可以有報料熱線98816992，係啦，98816992嘅。係咯。咁亦都可以用我哋報料熱線啦，亦都歡迎係inbox 我哋啦 ，Telegram 揾我哋嘅。係啦，咁多謝各位支持，拜拜。
喂，撳啊撳！完成。
唔好害人哋啲仔女啦。好心啊，啲行徑有乜辛苦？日日白色衫，白色衫，我哋嘅後生仔。好心啊，沙林樣，日日爭取下交，爭取下交，又破壞香港。打傳媒，打傳媒，打議員，打議員，打女仔，打女仔，打死黑警察嗱呢個家園啊！死黑警又唔做嘢，又唔讀書，死黑警唔讀書，害人哋睇。全家仔女都喊，死黑警，我冇罪㗎，點解要搞我咧？黑警就係我哋仇人，日日鬧事，黑警破壞香港法例，黑警破壞香港法例，黑警就係我哋仇人，黑警就是黑警破壞香港法例，黑警破壞香港法例，香港法例，香港法例。